Here you are. Good to see you all too. It's been a while.
It feels like it's been a long time, but 14. So let's see. I guess we can. Well, is Laura joining? Is she? I'm not.
Laura was out today, so I'm not sure if she's joining or not. I'm guessing probably not.
Okay.
And Kevin is not able to attend either.
Yeah.
Okay.
Okay. And I know you said Christine Harris is going to be able to join us. I don't see her yet, but that's okay. We can maybe start with so why don't I call us to order? Meeting called to order. And happy to see everyone. The first item on the agenda is public comment. I see that there's one member of the public present, Christine Griffin. I don't know if you have anything you wanted to raise with us, Christine? Sorry? Hello?
Someone else, a couple more people signed on too.
Hello, this is Christine.
Hi.
Hi, I don't have any comments at all. I'm just here to, as part of my nursing course, to attend a Board of Health meeting.
Oh,
Welcome.
welcome. What a
Hi,
great
Christine. It's
assignment.
Laura.
Thank you very much.
I'm a nursing instructor.
Yeah, this is
Glad to see you here.
thank you.
Thanks for joining us. That's a great assignment.
Thank you for having me. I appreciate it.
Of course. Laura, did I hear you joining us? Laura Vlasic?
Yes. Yep.
Hi.
Hi. I was just saying hi to Christine because I had talked to her by email and given her the information for tonight.
Great.
Christine, that was Chris. That's a member of the public. Christine Griffin that was just speaking. Oh, looks like we got a couple
Right.
of people.
Yeah, we had spoken by
I
email
see.
about her class and joining.
Got it.
And we have these twice a month, Christine, so join anytime.
Excellent.
Yeah.
Happy to have.
Yeah. I see there's somebody else. Andy, was there something that you wanted to raise with the Board of Health tonight?
Hi, good evening. No, I'm just a new resident to Reading, and I signed up to get notifications on updates. I've been receiving a lot of emails telling me about these meetings and figured I'd join to listen in, but are they open to the public?
Absolutely.
Okay. Well, thanks for
And
having me.
welcome.
Yes, welcome. Thanks for coming.
Thank you. I appreciate it.
And there's a couple more.
Yeah, so let's see. I see 978. There's no name. I see 978-880-5639. Is there something you wanted to raise for public comment with the board?
That's Christine Harris.
Oh,
Oh.
excellent.
That's you, Christine, right?
Okay. Well,
Then Richard, there's Richard. Do you see Richard there, Carrie?
oh yeah. Oh, Richard. Yes, I'm sorry. Yeah, Richard, is there something you wanted to raise with the board tonight? Thanks for joining us.
You're welcome. No thanks. I'm just an observer.
Okay, welcome.
Can we get your full name for the minutes, please?
Yes.
Richard Robbins.
Oh, hi. How you
How you
doing?
doing, Jean? Good to see you.
Good to see you too. Welcome.
Thank you, ma'am.
And I'm sorry, Andy, same question. Could you give your full name for the minutes?
Yes, it's Andy Hawthorne, HAWTHORNE.
Thank you. Okay, then. I
And
don't,
617, there's 617-823-5933.
That's Laura.
that's Laura, yeah.
Oh, hey, Laura.
Hi, and that other number is Christine Harris, the
Yeah.
nurse.
Yep.
All right then. Um,
I have a quick
Yeah.
comment.
yeah,
Whoever is doing the minutes right now, thank you, thank you, thank you.
yes. Thank you.
They're doing a great job, and it's a real load off our shoulders.
That was a big burden. So yes, I agree. Thank you. Thank you, whomever you are. Okay. 639, sorry. Okay, just making little notes. All right then. So I don't see anybody else. And I know Laura's joined us. So the first item on our agenda was the health agent flu clinic plan presentation for 2020. I've had I've sat in on participated in a meeting with the nurses. I know they've been doing a lot of work. Laura, do you want to take it away for us?
Yep, would you like to know when the flu clinics are or what, is that a good place to start? Or do you just want to know the quantity that we have booked?
I think when.
Okay,
and-
we're
and
doing
where
an
and-
open, we're doing an open to the public flu clinic at the Coolidge School on the 29th from 4 p.m. to roughly 6 p.m. We already did one at the fire department this week that just passed, and we have another one Tuesday night at 3 o'clock, but that is closed to the public. And then we have another one at the fire department, which is also closed to the public. We have two in the morning, both the 24th and the 28th, very, very early in the morning, but those are closed to the public. We have one at Cedar Glen on October 6th, 9 to 1, closed to the public. We have one Frank Tanner, October 8th, 10 to 12, closed to the public. So right now, the open to the public one is the Coolidge School on September 29th from 3 to 4. And we were hoping to use the senior center for a flu clinic if the board would give us the approval to do so.
Right, and I know there was some discussion about whether the flu clinic, how the senior center might work. What I saw made sense. I don't know if Laura, you can review what that was. Their plans are for and separate entry and exit points, and there are other strategies to try and reduce gatherings of people and ensure safety.
I haven't gotten to that. I've only been, I'm still trying to find out if I can have one at the senior center, and if so, then I would go forward with that.
Oh, okay. There were notes. Maybe it was an email. There was some discussion with Kevin Baumiller about what the strategy would be for that.
Yes, but I'm not even sure if we even are able to use the senior center at this point, so I need approval first.
From us? From us?
Correct.
The senior center
Oh,
is
okay.
the senior center is currently still closed to the public. The Board of Health voted to close it, I guess, in March.
Right.
The question is this an appropriate use to have the building not be opened necessarily, but to use the building for this particular use for a clinic? I don't know if there's any questions or discussion other members have.
I don't.
You know, if in terms of being open to the public, you know, we're talking about it just within the town, and if we had one open to the public at the Coolidge School, why wouldn't we just have another one open at the Coolidge School? I mean, there's not. I don't necessarily see a downside at the senior center, but I also don't see why we have to have it in different locations in terms of that. So that's the question: is why would we have it there versus just a second one at the Coolidge Center? Is there a compelling reason, or? Doesn't sound like it.
No.
No.
Laura?
I thought
That's
that,
the way they've, oh, go ahead.
no, I was going to say, I thought that this was coming from Elise, the nurse advocate who works closely with the seniors.
Okay,
They're familiar with the senior center, and that's the kind of the target group we're trying to get vaccinated.
sure. Yep.
That's why the senior center was brought up. I could be wrong.
Well, yeah, it was something that I do every year is have a flu clinic at the senior center. And the way I set it up is I like to have different ones in different locations. So in case for individuals who don't drive or don't feel comfortable driving or just ease of access, familiarity, just someplace that they can get to. So that's why we set them up at all various times and locations.
Okay, well, that makes sense.
And that's just the way I've set them up this is my third year doing the flu clinics, and that's just the way I've set them up, but I'm very flexible and willing to change, and I think I can speak for Christine on the fact that she's been very accommodating every time I've asked her for a different place or a different time. And like, even the fire department is just so you are aware so that we can get the most people vaccinated at the fire department. We do them at 6 o'clock in the morning. So we kind of make it so that we're all over the place in all different angles so that we can get everybody as much as humanly possible. So the senior center was someplace I used last year. I would like to use it again if it's okay with the board. If you don't feel comfortable with it or want me to do another one at the Coolidge, again, very flexible in whatever the board wishes.
I mean, as Jean's comments, I think if in fact there's a sense that the folks at the senior center would like it there and that it would be beneficial because senior citizens might feel more comfortable in that environment they're used to going there. And, if the facility's closed, there's no risk at all. So I personally wouldn't have any problem with that.
But plus the vans are now running now, correct? So that people who don't have vehicles themselves could use the van to gain access, correct?
I know we voted to have that happen. I guess, yes.
Yes, the senior van is on the road and it's mostly being used for medical appointments.
So people would be able to use that for flu clinic as well, correct?
I think so.
Yeah. So it makes sense. So should
Somebody make a motion?
I will put forth a motion to use the senior center for a flu clinic this season.
Second,
And the
roll call.
Paula says yes.
Carrie says yes.
Approved.
So moved, I
So
guess.
moved. Yep. Okay.
Can I ask Laura a couple questions? One is the closed clinics, those are for the town employees. Is that right? The firemen, the police, is that why they're closed? Laura?
Jean?
Yep.
I was told not to open them, so.
I'm just, who goes to the closed flu clinics? That's the question.
So I think the what's the public safety buildings are where these clinics are being held.
Right.
And so that's why they're limited to the public safety staff.
Okay,
The
That's-
buildings really aren't set up for having the public because police station, fire station, it
right.
just wouldn't work to have the public there.
Okay, so it's for public safety employees, not for teachers or administrative staff of the
No.
town?
No,
Okay.
it's just limited to the fire department staff and the police department staff in each respective building.
Okay, and if we had an open one at the Coolidge, sounds like we'll have an open one at the senior center. Would there be plans to have any other open flu clinics in October or no?
Laura, you
Laura?
want to do that one?
Well, the Coolidge is on September 29th,
Right.
and the senior center would be in October.
Okay. And would there be any more after that or no? I'm just asking. And
Oh, Christine said she's muted. She's having a problem with her audio. I think she's trying to chime in. It's up to you guys. It all depends on how much we have to see. We have Frank Tanner, Peter Sandberg, Cedar Glen, the senior center, the Coolidge, 2 at the police station, 3 at the fire station. Sorry, 2
Laura,
at the
can
fire
you hear
station,
me
3 at
now?
the police station. Yeah.
Yeah.
Okay.
And then we want to do the DPW as well. So we'd have to see how many vaccines we would have left. Last year, I think we ran 9. So this year we're at 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 so far.
okay.
And then, of course, the CVS's and the Walmarts and the Walgreens all have their flu clinics as well.
Okay.
So I think there's plenty of access, it sounds like.
Right. That was my concern, but it sounds like the problem.
Yeah, I would be concerned in running a second one at the Coolidge and another one at the senior center and then just running out of vaccines. So my opinion, I would run 1 at each and see how it goes and then see what we have left.
Okay.
We could always schedule one at a later date. Yes? If we have enough left. Is that right, Laura? Or Christine, or both?
Yes. Could I just make a comment with regards to the senior center? With the use of the senior center, has that been, and I apologize that I missed that part, has that been given the okay, or are we going to hold off on that?
We voted to use it for a clinic and to serve the seniors as Laura described.
Okay, great. Thank you. Sorry.
No worries. Was there something else you wanted to raise, Christine, or?
No, I just wanted to state that Elise Warren and I have both been on multiple calls with DPH in regards to how to run a safe, influenza vaccine clinic. And, we would do it by appointment only, use 1 entry, 1 exit. And I just wanted to let everybody know that.
Great. Thank you for that clarification. That's helpful. In terms of vaccine, I know there are a variety of vaccines. What is Reading offering?
Yeah, so we have the Fluzone High Dose, which is for anyone that's 65 and older. And then we have the lower dose, which is Quadrivent is what it's called, and it's for vaccines for under. We do not vaccinate under 18 years of age.
Okay,
Oh, okay.
great. Thank you. Quadrivent 18 to 65. Great. Thank you. And I know, Christine, you're on our agenda for a nursing update, so I'm sorry to put you on the spot a little ahead, but we're talking about food
that's
clinics, so.
No, that's
I'm
okay.
sorry.
Great.
And I accidentally dropped you guys. I'm back. Sorry about that.
Welcome back.
Date for the flu clinic with the senior center, is there something penciled in at this point? So now that it's been approved, I didn't know if we're holding a date.
Yes, we were discussing a couple of dates the second week in October.
Okay.
Second Tuesday or Thursday of October. I can get the exact date tomorrow.
So October 12th is a holiday,
Okay.
just so you're aware. That's one of those.
Sure.
Is that the Monday, Columbus?
Yeah.
Columbus Day
Yeah.
weekend? Okay.
They call it something else now, but I'm not sure what.
I'm not sure. So 13th and 15th were the possible options. And Laura, you and Christine are going to work together and sort that out?
Yes.
Great.
Yeah, well, Christine can do Tuesday or Thursdays because she works on Tuesdays or Thursdays. And I guess Elise has some childcare issues during the day where she has to wait for her husband. So we're going to work around Tuesday or Thursdays when Elise is available based on her kids.
Great.
So we're all
Thank you.
working together.
Yep. Thank you. There was a question in the chat. Natasha, I'm sorry, I saw your name, but then we were tangled up. Natasha, did you want to speak?
Hey, Carrie, it's so great to hear your voice and see you. It's Natasha.
Natasha?
We know each other. We go a long way back.
Yes. Can you give your whole name just for the minutes? Thanks. I'm
Sure.
so glad to hear you. Yay.
My name is Natasha Waden. I'm an Arlington resident. I'm sorry, a Reading resident. And I was just wondering if the Board of Health or Health Department will be holding any public clinics for school-age children.
No.
So it's a good question because I know it's mandatory this year for the school age kids to have flu.
Laura or Christine, can one of you take that?
Sure, yes. So no, we have decided not to hold for under 18 years of age. And I've been in talks with Mary Giuliani, who is the nurse at the Reading High School. I don't believe Reading has ever participated in flu vaccine for children under 18. And what we're advising is that they go through their pediatrician or a CVS or Walgreens at this point. We did not order for under 18, enough vaccine for under 18.
Okay.
Just so you're aware, though, we couldn't order the vaccine because we would have had to have ordered it last year. And since we never do it,
Yeah.
Oh,
it was too late to order it once they made it mandatory.
okay. Thanks for clarifying that, Laura. Thank you, Christine. And I hope that answers your question, Tasha. Thanks for checking in with us.
Thank you.
Okay. Laura, anything else for us on your regarding flu clinics? I know you work real hard on these.
No, just plugging away on them, trying to get them booked.
Do you have any estimates of how many people get served at any of these clinics, these dispensings?
Last year we did over 900.
Wow.
900 for the
Flu vaccine.
for the whole season, not 900 at one clinic,
Right,
or is that what? So 900 total. Okay.
right.
Okay. Great. Does anybody else have other questions?
No.
Okay. All right, then. Moving on then to our public health nursing update. Christine, thank you for making the time to join us tonight.
Sure.
The floor is
Yeah.
yours.
Okay, well, I just wanted to, thank, and I have done so, the group of nurses that's been assisting with, the cases, the COVID positive cases have been extremely helpful. And if I did not have their help, I'm not quite sure I would be able to manage them all. The numbers have gone down significantly, which is nice to see. And what we're focusing on right now is a lot of contact tracing, making sure that clusters don't develop. We have a list of contact people at each school, at each large, like Austin Prep, for example, the Montessori schools. And what we're doing is just reaching out pretty frequently, if not daily, every other day, just to make sure any clusters haven't developed. I have a very good point of contact with the CTC with the Department of Public Health. Her name is Sandra Aronson. We have a weekly meeting on Thursdays to discuss travelers report, as well as the number of people that she's actually just doing strictly contact tracing, not positive cases. So that's been very helpful. It's in a secure folder. So, you know, just myself has the privilege to that information, but she's extremely professional, and she's actually planning to put a meeting together with Elise Warren, Sharon Groton, and Mary Giuliani from the school. Elise is the senior advocate this week, just to go over what her roles are, and if any clusters do develop in school, what would be a clear protocol to follow, and how we can all communicate, stay on top of it.
Mhm. So I'm glad to hear that you're working with the folks from the CTC already. I know we talked about that as the resource should there be a need for additional contact tracing support now that school's back in session and the school nurses are fully occupied. But it's nice to have a relationship in advance of that, and maybe hopefully it won't happen. You won't need them, but to have the contact, I think, is a great strategy. I'm glad to hear that's working.
Yes. And then I guess just on a subject that's not COVID related, there are a few things that in future planning that I am working on, and that will be eventually restarting the B12 injections at home, as well as the blood pressure clinics. And I'll be working with the senior advocate, Elise Warren, probably for the first one once things have opened up.
Sounds good.
That's great. Yeah, and I appreciate you saying that. Yeah, there are other things besides COVID.
Yeah, really.
I believe.
It's important to it's important to remember that. I think we all do, but yeah, certainly we do. COVID is taking a lot of attention and effort, but there's a lot of effort that's happening that's not COVID related throughout the town, and I know Laura's busy and the like. So, do other members have any questions for Christine? Anything that they were hoping to hear about for the from her while we have her time?
Yep.
No. Okay.
So, thank you, Christine, for all your work.
Yeah, thank you for letting me, for inviting me on the call. I appreciate that.
Of course, we're thank you for joining us. And I guess, and I'll say that I had the opportunity to participate in a meeting with Laura and Christine after they had finished one dispensing site, and the school nurses to talk about what I think Christine had already raised, talking about how to coordinate with the schools should there be instances of cases in town. And it was a great opportunity to see all of the folks that contribute to the work, and to hear them work through how they will coordinate communication. And I'm grateful to all of them. And I think I said it was kind of it was a privilege to get to watch it. I got to ask a bunch of questions, and just see how well covered we are, and how thoughtful the nurses were in trying to plan and anticipate needs. And that's so important. And I thought that was great. So thank you, Laura and Christine, and thank you all the other folks that participated.
Thank you.
Okay. So then moving on, our next item. So now we go to COVID. And I think everyone received, or the board received the updates from command, which was held on 9/14, anticipating that we were going to be meeting on 9/17. I attended. I think there was one clarification. There was a question about, a little bit of discussion about the library opening, and there was, in the note taking, I think there's a remark that I said something about all the employees being fine, and that was actually, it was a conversation between Bob Lolasher and I. So I'm asked for just that to be clarified. It was a great meeting. School is working hard. I don't know if there are questions about the notes or if anybody wanted to raise anything that they wanted to hear more about.
No, I think the notes are very clear.
Yes.
Otherwise.
Yeah. Agreed.
Yeah. I believe that that's Jane Wellman that's doing those, or was it initially anyways, or whomever's doing it. They were nice, tidy notes. It was nice to see.
Very nice. Very nice.
Yeah, it's very helpful. So that happens. So the next command, so remember command is scheduled, they meet the Monday before our scheduled meetings. So we met on the 14th, anticipating a meeting on the 17th. So their next scheduled meeting for command would be
Next Monday.
Monday, the 28th.
Mhm.
So this coming Monday. Just want to clarify that. Okay. Coordination with schools. Christine, are you still with us?
Yes, I am.
Can you talk a little bit about some of the things that you have in place with the schools for coordinating about case information? Just a little.
Sure, of course. So right now, the nurses from the school system have been kind enough to, assist with the COVID positive cases over the summer. Since the return of school, Mary will not be able to do so. One of them, Sharon, has been kind enough and agreed to continue working the cases on a Saturday. That aside, if a case comes in through Maven that is positive, I would be in touch with Mary, or she would be in touch with myself, but we would be in close communication, and I would work the positive case as well as the contact tracing. However, we would need to get the CTC involved if it became a cluster, meaning like 2 or more, or a larger group that we just felt that needed daily check-ins. And we actually have a meeting set up with her today to put a specific protocol in place.
Okay, that's great. And I know there's some talk about coordinating so that if there was a cluster, ways to access testing services and the like. So there's a lot of anticipating happening, a lot of pre-planning.
And if I could add 2 things to that.
Sure.
Those numbers are reported every day to police and fire department, all emergency responders. That way they know before entering a home. And then every Wednesday, all those numbers are reported so that they can go on the town website. Just for I know you guys know, but just for the people that are on the call in case they weren't aware of that, those numbers are reported every Wednesday at 4 o'clock. And every night they're given to emergency responders so that they're prepared before they enter a home.
So the information about the specific information about the cases is given to public safety for that.
Right. Right. And I know you guys know this because we've been doing this all along, but I just wanted to add that in case someone on the call didn't know. And I apologize if you already knew.
No, it's good to clarify that.
Yeah. Okay.
Thank you, Laura.
Yeah.
we work very much as a team in the health department. So we all have a little bit that we do to help the other, and everybody's been great. The nurse advocate, the school nurses, me and Christine work together every day. So that's just flawless, and it's just a very well-oiled machine.
Fantastic.
Okay.
Can I ask on
Please.
just on that? What either Christine or Laura, Christine actually, what do we think your capacity is in terms of numbers of cases that you could manage? Do you have a sense of, like, I think last Wednesday there were 16 active cases. At what point would you almost have to send everything to the CTC, or you'd overwhelm the nurse who's doing it on Saturday? What is our capacity sort of, do you estimate?
I see what you mean. Yeah, I see what you mean by that. And it is a great question, because to work a case is not, it's pretty time consuming. It's not, it takes a good hour. And that's per person to work an active case, because you're gathering a lot of information as well as any contacts, and you're making multiple calls, whether that's to a laboratory or a primary care doctor's office. So honestly, and I'm just giving a rough estimate here, per day, and I work 3 days a week, about 8 to 10 cases a day, a person.
Okay.
And I know that doesn't sound like a lot, but it really does take a little bit of time. It's not a quick phone call. A lot of data is involved.
Okay.
And then it all has to get entered information.
Can you say again, Paula? You're breaking up a little.
Sorry. And then it all has to get put into Maven, correct?
Correct.
Great.
Thankfully, the system that we have right now is on the days that I am not covering Maven, which is I cover Tuesday, Thursday, Sunday. There is coverage there right now, which is great. If it became a point that there were more than 10 cases in a day, I think we would then need to fall back on the CTC. My hopes are that will not happen. However, they do encourage that we perform more contact tracing, which is not necessarily a notification in Maven from the Department of Public Health, just a secured list of residents that we're following.
And I noticed, Christine, on the let's see, it's only Monday, so on the Friday call for local health, folks from the coordinator from the CTC, the lead guy, John, was there, and he said that they've actually shifted their protocols a little bit so that now towns can retain the actual cases, but can hand over the contact tracing only to the CTC. That's a little different.
Yes, exactly. And that's, I believe we can do that. I do not feel we are going to have to pass off any positive cases that come in, any confirmed or probables. I feel that we have the coverage to address them and follow them through. And again, I understand it's hard to predict what clusters may occur, but I do believe we have the coverage and the capacity to follow all active cases. Where it gets to just following contacts, that could be, we may have to fall back on them for that, but my prediction is we are not going to have to use the CTC for positive COVID cases. I feel we'll be able to keep them we'll be able to follow them ourselves in Reading.
That would be lovely for many reasons. So, and yeah, I was glad to hear that the CTC had shifted their protocols a little, because that seemed like a nice division of resources. And I know that wasn't possible in the spring. So,
Yes, and the CTC also has great resources. In other words, if a resident in Reading needed food, or if they needed social or psychological support, if we needed to have mobile testing or free testing or something like that, they have some great resources that we can use if needed.
yes. Thank you for raising that. That is one of the nice things that they've done, and try and make themselves responsive to what they found were questions that people had. That it couldn't just be a simple, where were you, and what time, and so forth. So that was a nice thing, and that's great that you can connect with that piece as well. So
Okay.
okay. Anything else? No? Ready to move? Okay, so the next two things on the list are kind of intertwined, and that's civic function permits and recreation permits. And I know there's been a little back and forth. There was some use of that form, and I think so. Laura and I, it has been a challenge to actually keep up with the demand, and I think there are a couple things that are outstanding. I don't know if there are other ways to organize the review within the health department. Certainly don't want to overload folks. So Laura, I don't know, do you want to talk about that at all?
No. We have a few that are outstanding.
Right.
Do you need help with that? Is that something I can do to help?
So it's not clear to me. I mean, the way we agreed that we would work this was that Laura would review, and she would paste in using the form that Rick added, and then send it to me, and I would sign off. And I know we had talked about if we need to shift that, around. But I think the schedule's been such that it's been, I don't want to put words in your mouth, Laura, but I know we talked about it being a little challenging.
Right, you still have golfing in Reading and karate to approve, or nickel bones. Two of the three are done and waiting your approval. And sorry. Sorry. And the third one is not completed yet.
So, and I think this is part of it, because I only have one, and I know we've talked about this. I know I owe you one. So there's a workflow challenge that I'm not sure quite how to address. And I know
which one are you missing though? Because I sent them both to you a couple of times.
I have you seem to think you sent me basketball, but I don't have it, and I don't have karate. I only have knuckle bones, and I know that Jenna had sent a couple additional ones, and I haven't seen those yet.
Yeah, she sent those over the weekend, and I did not open my emails over the weekend. But I know I had sent Christine the one we were looking for by accident twice, and then I was like, oops, when I was on the phone with you, and I forwarded it to you, so I know it's in my email.
Well,
and I think that was the basketball. You should have two of them.
So are you? I have a lot of minutes. I don't have any basketball, and I guess I want to, rather than get into the individual specifics I want to kind of talk about the process, and if there's a way that we can improve this to help you and to make sure that we're meeting the deadlines that are getting set, or if the deadlines aren't being set appropriately, how we would address that. It seems to be still there. It's a new process. It seems like it still needs a little ironing out, and I wanted to get your thoughts on that.
I don't know. I sent them over. I'm looking for them right now so I can resend them to you, but
So
So is it possible that, that Dan, could review these? I mean, it isn't a highly technical
Yeah.
skill set, you know, it's just.
right. Yeah, he
comparing the
doesn't do
guidelines.
weekends either, though. The only two that haven't been done were the ones that came on the weekend, but Kerry has the other ones.
Right, but I was just raising the question, Laura, whether, can Dan, also review these in the health department, so that, you know, it would help, it would support you in terms of, you wouldn't have to do every single one of them, but you could do half of them, he could do half of them, or is his schedule, I don't really know, or is his schedule so,
Yeah, no,
Busy with
he's doing
inspections.
inspections. He's very busy with inspections. He couldn't do this.
he wouldn't be able to do those? No. Okay. Christine, who else is there?
right,
You know,
yeah, are
that's,
there
that's
other
part of the,
resources?
you
Is
know,
that something Christine could take on? She's familiar with the guidance, or?
I honestly feel they should come from me, but
So do you feel like, so, I mean, to me, this process isn't working well, and I'm trying to, but it sounds like maybe you don't, do you not share that perspective?
no, I know I don't.
Well, I'm okay. I mean, I know that we've missed deadlines. I'm aware that there were events that we didn't review the documents in time. So to me, that's a sign that it's not working well. And I know karate
Right, and
has been
prior
hanging out
to,
for a little bit. Sorry?
but you have the karate one, correct?
No.
Which two do you have?
See, this is part of the problem, Laura, is that I can't manage this process. I need, and that's what I think we're trying to get at is how can this process be managed? Is there somebody that could keep a spreadsheet? Is there a spreadsheet already that could be shared of what's outstanding?
So you're saying that some way of tracking so that it's simpler, not just.
Yeah, I can make a spreadsheet of when I get them and when I send them to you, but I was just sending them to you in hopes that they would just get approved and turned around. But I can start tracking exactly which ones come in, when I send them to you, when you send them back, and what the deadline is that the event is going to start. I can create a spreadsheet for that.
Well, the other option is we could have Jackie help. She's the one that manages the civic function permits. Maybe there's some, I don't know, something that she can think of from an admin point of view to make this easier.
Right, but if I'm going to make a spreadsheet, then is Jackie going to make another spreadsheet?
Well, I was thinking, I don't know if there is something that IT could help in, you know, I know Google Drives aren't, you know, something that the town embraces, but I think on other projects, there are some other technologies that can be useful so that you're not relying on email to just keep creating documents back and forth. Would that maybe help?
Yeah. Yeah, because I've got a code. Yes. So part of this is I do think we could really use an administrative thing so that maybe there's a check-in on Thursday mornings of these are the outstanding ones. I have outstanding Cub Scout and Girl Scout plans from last Wednesday from Jenna. But I don't have karate, and there's a lot of email that goes back and forth. I'm finding it really challenging to track and certainly want to be responsive to the review needs.
I have a specific question. So I know that you have the karate one. No, the golfing one for an event in North Reading. Has that one gotten approved?
I am not aware that I have anything for golf, Laura.
I got an email from you on November 1st at 7:58. I can forward it back to you if you want.
I think an administrative assistant would be very useful.
Well, I
It could be
think
the-
it would be useful if we could close them out though, too. Like they
Absolutely.
just seem to go back and forth, and there's never a final yes or no.
I think if someone was tracking them and could prompt, Carrie or who's ever doing it, Paul, who's ever
Sure.
we decide to do it, could be the person that, is kind of tracking it. And on Thursday, if they don't hear because they sent it on Monday, that they could, email. And then it would actually, Laura, take you a little bit out of the
No, I'll create the tracking
Day-to-day.
system, and I'll make sure I report it on, well, I already did the other report on Wednesday night, so I'll do that one on Thursday morning. That's not a problem.
Go ahead, Rick.
No, I was just using that as an example, not as a concrete thing you should do. But, perhaps this, I don't know. I think we're brainstorming here a little bit of,
I think that some administrative support would be great, Laura. I'm not sure. I wasn't asking that you.
Yeah, but I have no problem doing it, so.
Hmm.
I'm not saying you told me I had to do it. I'm just saying I'm volunteering. That's not a problem at all.
So you could set something up that would be sort of a weekly prompt of these are the ones that are out. This is the list of what's outstanding. Status check.
Sure.
Okay.
And that would include the things that Jenna's involved in rec?
That's what we're talking about.
You're talking about the civic function permits and rec is what I'm asking.
Correct. Because it's the same process where it's supposed to be that Laura has it. She reviews and gives her assessment of whether they meet the COVID guidance. There's a little checkbox form there with the, approved or, recommendations for changes. And then that's supposed to get just forwarded to me. We'd said the chair would do that to review. Just as a second eyeball, since we are actually saying we approve something, it seems that the board ought to actually be reviewing. So, okay. So could you start that, Laura, with whatever it is that you have as outstanding now? Because I've seen what you have just forwarded to me, and that I understood was complete. That's from a couple weeks ago. So I thought I sent it. There's some communication and email confusion happening. And if we can get a common list with the names and the dates, that would be helpful and maybe get us on track.
Sure, I'll start making a list.
Anybody have any questions about this? Any other thoughts? I have to say, I find this one of the most frustrating aspects right now of the work. It's you know, we are wanting to, you know, make sure that we're helping people, you know, making sure they're following proper safety guidance and also making sure that they're able to have their events timely. And it's still a little clunky. And I certainly will own that, you know, I have a full-time job and I run 3 email accounts. So, you know, I have a lot, but I do work pretty hard to keep track of things. So,
Why I said to do this. I
sorry?
can take this. I'm happy to do this. I can take this on.
Okay. That's great. If you want to take on
I mean, I feel bad that you're taking all of this on in addition to your work.
so,
Yeah.
No. And thank you, Paula. That's kind. I was not a complaint. I want to be sure it's clear. I was not complaining. This was something that the former chair was doing, and I was happy to take it on. And for me, the frustration is that it can't seem to get the process straight, and we're kind of doing a lot of back and forth of what's ready and what isn't. It's not the burden, but if you would like to take on this and work with Laura on this, I'm certainly open to that.
I'm willing. What do you
Okay.
say, Laura? Should we start working together? Are you there? Did I scare her off?
I don't know.
No, sorry. James was being loud, so I put you guys on mute. Yeah, that would be awesome. Great.
All right, so I will talk to you tomorrow. Okay?
Okay, sounds good.
All right.
And I'll start making the list.
I'll go through my email and I will.
So then golf in North Reading is done.
I'll go through my email when we finish the meeting and send you a list of what I have signed off on and when, and what I'm waiting for. And we'll try and clone it, and then we'll reconcile all the lists and we'll let Paula have at it.
Perfect. Sounds like a plan.
Okay,
Okay,
sounds good.
thanks, Paula.
Sure.
Okay. Okay, so then moving on to, so on other, you know, with COVID being as it is, we try and leave open discussion. For me, I know there have been a few complaints that I've fielded myself. I don't know if other board members have been approached with any issues or not. I'm seeing no.
No.
Okay. And I don't know, Laura, do you have any updates on let's see, we talked about a case that had happened, and then there was a follow-on complaint about Reading youth hockey activities. Do you have anything more on that?
Yep, I inspected the, they call it a stadium in hockey?
Arena.
Stands?
I think it's
Arena, thank you. The arena for social distancing, everything has been cleaned by a professional cleaning company, and they're adhering to the rules. They got the rules from me again, and they have the rules from the Hockey Association. And I met with them, I talked to them, I didn't see them in person, and they're aware of the rules. And
Sorry, can you clarify them? Who is them?
the Hockey Association?
I just, there were a few, so I didn't know, because I know you had said you had spoken with,
Paduta at the hockey rink. I met with him.
right.
And then
that's
I
right.
spoke to, I forgot the gentleman's name. I didn't know you were specifically going to call out the hockey rink, so I didn't have it open. But I got the information from Jenna, who it was, and talked to them about the rink. But I don't remember the man's name off the top of my head.
That's okay. So you were able to, do you want to share any background for the board members of
I don't, so I would be paraphrasing, so if you'd like to, that's fine.
Could I just make a comment to that? I'm familiar with this complaint. This is Christine. And I do remember having a discussion with Laura about it, and actually spoke with the EPI of the day, the EPI that was on call, because I believe it was a complaint that came in over the weekend. And yes, and we did, just to make sure before giving guidance, we just clarified with the EPI of the day. We wanted to make sure that whoever the contacts were, that they were appropriately following the quarantine guidelines as well.
So it sounds like maybe so I know what you're speaking of, Christine. There was a issue of a case, and there was a need for some cleaning, and the rink did great. I'm paraphrasing Laura now, that was very responsive and closed down and cleaned, and that was fine. There was a separate complaint, not related to the positive case that was identified. There was a separate complaint about activities happening at the rink amongst a variety of age groups, and questions about whether there was social distancing, whether the numbers of spectators were being properly taken care of. There was a question about whether masks were being used appropriately on the ice by coaches and athletes. There was a question about whether there was appropriate social distancing occurring on the bench, or whether athletes were maintaining 6 feet distance when they were not on the ice but sitting on the bench. And this was
Sorry, you're both right, though.
If I can just finish, sorry, Laura, so I got, right, so there were two issues, right? So I think what Christine's clarifying about is about the case, and I just want to make sure I'm clear that this is, that what I'm following up on is the other piece.
Okay, sorry about that.
No, you're fine. That's fine. I mean, part of it is that, unfortunately, my fellow board members weren't part of these conversations. So we need to do a little backfilling to help people understand, and to differentiate. So those were separate. What I got was I think a combination of a few different observations. And so it happened, it just came in at the same time. So Laura was already working with them. What we talked about was the fact that both the rink is responsible per the guidance, as an operator of facility, but also the organizers of the athletic activities, whatever activity is, they have a responsibility to make sure that the guidance is being followed, that it's not solely on whoever has the field or the arena, that, Reading Soccer or Babe Ruth or Reading Youth Hockey all, are responsible for working with their folks to make sure that the guidance is followed. Am I saying that? Is that okay?
Yeah.
There.
Thank you.
That was a big mouthful, Laura. Now, sorry, I just need to get it all out. What were you going to jump in with?
Your complaint and one Christine's talking about were actually on the same day at the same time, the same event. So they both, the day that I spoke to Christine and the complaint you got were both for the same Saturday.
I don't think mine was
Sunday.
different days.
So they kind of,
Yours was on a Sunday.
yours came in on Sunday for Saturday, and I actually talked to Christine on Saturday.
Mine wasn't for Saturday, is what I'm trying to tell you. Mine was, I documented the discussion on Sunday. It was not for Saturday. It was for previous times in the week and over the course of time with them. That's what I'm trying to say. Anyways. So Laura, you're saying that not only did the rink clean up, but that you were in touch with the organizers for Reading Youth Hockey, and you saw the facility when it was in use, or you saw it when they had finished cleaning up?
After they finished cleaning up prior to reopening.
Okay. And Reading Youth Hockey was under you said you gave them the guidance, you communicated, you gave them the guidance, you gave the rink the guidance again, and that has been communicated to them. Is that right?
Yes.
Okay. I think this came up in command, and I think this is part of the notes that folks would have seen. There were a couple of instances of reports like this. I also received a report from 3 different people about people encouraging baseball to fill the stands for watching a game, and these kinds of things that are concerning, because we know that as people gather, as more people are present, that is increases the likelihood of transmission. And we have had a beautiful case rate. We're very fortunate right now, but it really doesn't take much to change that.
So I was actually thinking about that over the course of the week, especially after seeing Dr. Fauci's webinar, which was excellent. I had seen it last week. This is a time where I feel like people are starting to let their guard down.
Yeah.
And it's not the time. I mean, and I was wondering if we as the board should maybe post something about keeping their guard up. This is just to encourage people. I know people are really getting tired of all of this. It's been months now, and I get it. I get tired. But I just thought it would be wise on our behalf, or on everyone's behalf, if we as the board did some sort of just a quick blurb or something on the website.
That's a really great point.
I think particularly, in terms of the number of active cases, although they're very small, they went from 4 to 9 to 16. I'm holding my breath on Wednesday, but if, let's say on Wednesday, maybe Laura or Christine already know what the number's going to be, but if it's 25 or 22, that would lend a little bit more urgency to a communication from the board about not letting our guard down, because they're sort of like doubling,
Yep.
Mm-hmm.
Agreed. I think we could work with, I spoke briefly about this with Jane Wellman, sort of just conceptually of, are there ways to communicate? I know she was the one who organized the communications plan for
The voting.
So perhaps we could work with her and see what we can get out to communicate. Because I agree, Paula, and this is why I'm
this is
talking
what
about
has
these
been
complaints.
nervous.
This is so worried. This is a real vulnerability. So, okay.
So if you want me to, I would reach out to Jane and try to hash this out and put something together. I'm happy to do that.
That would be great.
If we're in agreement that this is something we should do.
100%.
Just reiterate about mask wearing, social distancing, hand washing, et cetera, et cetera.
Yep.
And, sort of do the cheerleader thing to try and keep everybody focused on that.
Yes.
Okay. I will do
Definitely.
that.
Thank you, Paula. That's excellent. And important. Yeah. Somebody made a joke to me about public health being the fun killers, and I really, I mean, I kind of understand where it came from, but
Yeah.
This is not something we
I know.
we want to play with. We are in good shape, but it's very easy.
And Fauci basically said this too, that this is not the time to, I'm sorry, I'm talking over you.
No, you're fine.
I'm sorry.
No, you're fine. Go.
This is what Fauci was talking about. Rich, I don't know if you got a chance to see that video, the webinar.
Not
It's
yet,
excellent.
not yet. Yes, I
Yeah,
appreciate
it's
Terry
well
sending
worth
that. I
it.
haven't.
Yeah. So, okay. I'm
Excellent.
happy to do that.
Excellent. Thank you. Right. So we got the senior center. I'm just looking at my checklist. Sorry, I missed a thing. If I'll just take a moment to follow up on an item that was raised before. There was a question about MAHB training, Mass Association of Health Boards training,
Yes,
and the availability
I
of
was
that.
going to ask about that too.
Yeah, so I was in touch with them. They are planning something. They did have in-person sessions scheduled for this year, and they are working to arrange for some kind of virtual experience. They don't have details yet, but as members, they will communicate to us, and I'm monitoring that site, so I'll keep an eye out as well. And Laura had a question about whether those trainings were open to staff or solely for Board of Health members, and I confirmed that at least in the past they have been available for staff and boards of health members, and the person I spoke with said she didn't know what the arrangements were for this year because of the virtuality, but she didn't see any reason why, she expected they would be doing the same. So that's one. So I look forward to that. They're a good resource. And then on the topic of training, the Massachusetts Health Officers Association is another membership public health organization in the state, and they have a training coming up that will be a virtual training. It's 3 consecutive Wednesdays in the morning, and I believe it's the 15th, the 22nd, and the 29th. If you go to their website, you can look at that and sign up. I know that they're including Loretta LaRoche, who's a well-known stress expert and humorist, is actually the plenary speaker. And
Nice.
really excited that that's a resource for the public health workforce. It's been quite a slog in general for folks. So
Yeah.
there's that. There will also be presentations by the commissioner of DPH and by the state epidemiologist. So Dr. Burrell, the commissioner, and then the state epidemiologist and state veterinarian, Katie Brown, will also be speaking. And there's actually a double session, a great session being run by someone from the Office of Environmental. It's in the Environmental Health Bureau, and it's a plan review. It's about food inspections. It's a double session that's quite popular every year for folks to attend. So they are doing it with a COVID lens this year because they're recognizing there are additional layers to review and inspection because of COVID. Most of the sessions are COVID related. I think 7 of the 9 are COVID related. So I wanted to highlight that for folks if they have the time, ability, wherewithal, and I will be attending because we're all just learning. Okay. Anything else on COVID before I move us on? Okay. Board of Health vacancy. I heard from Ann Landry, the select board member who is our liaison, that I had inquired if I wanted to make sure it was on the agenda for this Tuesday. It is on the agenda. There were no new applicants for the Board of Health. The existing slate that was contacted, and the volunteer committee members were reaching out to folks. I think, Rick, they're reaching out to you.
Yes.
Excellent. And so that should be on the agenda and voted on tomorrow night. And that's what I know. I don't know if there are any questions or further comment. Yeah. Thank you, Rick, for
Yeah,
stepping
Yeah,
up.
so I had my interview earlier this
stepping
evening.
up.
Oh, good.
What's that?
I had my interview earlier this evening with the
Oh, good.
volunteer appointment.
Good.
Great. Thank you for doing that. So,
Sure.
there should be we'll see what we have after the select board vote meets tomorrow night. Then meeting schedule. So we're continuing on the first and third Thursdays of the month, and command is the Monday preceding that for each of those. I have in the past said that I'm happy to, and I continue to be happy to be the board rep to that meeting because I have the time, but I don't want to hog it if others want to attend. I may need someone to cover it for me on this coming Monday. I don't know if anyone's available.
Yeah,
Sure.
I can.
Oh.
Paula, you want? Whoever, one of us.
Over it. So you're talking about command, next Monday's command meeting.
Correct. On September
Okay.
28th.
I get, well, before I say that completely, let me just look at my calendar. I don't think I have anything.
Just to recap, the Board of Health is the first and third Thursday of the month,
Correct.
and the command is the second and fourth Monday of the month.
Oh, is that how it goes? Okay. I just counted backwards, but yes, I believe you. I'm just,
That's what it is for September.
So do I need to get a Zoom invite to go?
I'll make sure that Chief Burns knows to invite you. Yes.
Okay.
And I appreciate that. I had anticipated I was going to be able to go, but I'm not sure that I think there might be a conflict. So if
Not a worry.
thank you. It's a nice, it's a nice group. We really are well served in Reading. We really are.
Yeah.
It's one of the lovely things about serving on the Board of Health is the people that I've gotten to meet, such as yourselves, and also to get a chance to communicate with our leadership in town. And I really think we're well served. So.
Indeed. Indeed.
Okay, all right, so then we go to, down in, there's two things. So the public health needs assessment. And this was kind of a global discussion. I know we've talked about this a little bit. This was about both wanting an internal assessment for the department and then also looking ahead to doing a community health assessment or a strategic plan, kind of folds all in together. And what we have done, what we had accomplished, Jean had identified some names initially for us, and Laura did some outreach. And of the outreach that she did, there was only one respondent. Outreach, I did a little more poking around on it. I found reports. I found a strategic plan report from Nantucket, which I know was done all in-house by the director and the team there when that director joined the Nantucket department. I also found a strategic plan from Plymouth that had as an attachment had a department assessment that they had done preceding that.
Mm-hmm.
And I was able to find a scope that roughly matches that Plymouth assessment. And it's just a couple of paragraphs. So that's just the scope of work. I have that, and I'm going to try and share my screen in just a second.
I read that Plymouth one, Carrie. Thank you. I thought it was very helpful.
Good. I'm glad.
I thought both of them were very well written, and they seem to be none of the attributions of authorship were any consultant. Were they both done in-house by town or city staff? So it was pretty impressive.
Yes. For the community assessment, yes, the town chose to kind of engage in that, and I agree. I think that's a really I mean, I think that's something we should talk about if we have the capacity down the road to work with the data that we'd still need gathered. I think that's the question. You need to do some surveys, and is there sufficient data from Melrose Wakefield Hospital and Winchester Hospital and the BRFS, and whether there's data from the coalition. I know they gather a great deal of data, so it might be possible that we can work with that. And yeah, I thought they were both quite well written. The staff assessment piece. So let's see. I am screen sharing right now. Can everyone see my screen?
Yes.
Okay.
Yep.
So this is a very simple document. It's a lead person. Oh, look, there's typos. I thought I cleaned them up. And it's about, interviewing, arrange meetings with town officials, including but not limited to community stakeholders. So we could identify, as I understand it, we could identify who those folks would be. So that's the implementation piece. And then the responsibilities would be to review environmental health, tobacco, emergency preparedness programs. I don't know if we need to augment this, food inspections, etc. To look at the status and provide a final report, much like the Plymouth one. And then it just outlines that the town, will be able to make staff available to participate in this, and will help, support that. Support this process. So very simple. It's my proposal that I would use this to try and follow up and see if we can get more. I think the big consultants are a little busy. I know HRIA was on our list as a possibility, and HRIA is currently doing a COVID community impact survey across the Commonwealth, and they're putting enormous resources into that. So I think this is a smaller job. I believe that it would be under procurement standards, it would be below the $10,000 threshold, so would not require bids, require sound business practices. I have identified so I looked at who had conducted the Plymouth assessment. So those names, I have a list of 4 names that are experienced public health folks in the field who have done this kind of assessment. And I can tell you that's, I know 2 of these people, I know of 2 of the others. So one of them is Dan Ottenheimer, another is Michael Coughlin, another is Steve Ward, and the 4th is Deb Rosati. And 3 of them I know, I did my homework. 3 of them are former health directors in multiple communities, cities and towns, and have experience in foundation, and also are experienced in doing this kind of assessment. So it's not enough to just be a health director, but to have done some of this assessing. I think the other pieces that we Rick, I know you had raised the very good point of wanting them to anchor their work to the Blueprint for Excellence document, which Jean had shared with us.
Right.
So it's my proposal that I'd share this roughly with the list of 4 and ask them if they could submit quotes. I don't know if it's me that shares that or if it's someone from the town. Maybe Jean can guide us on that.
That is all handled by our chief procurement officer.
Okay. So I could forward the names and the this piece of the scope to the procurement officer for review, and they look at it whether it's subject to bid requirements or not. Is that right?
They execute the procurement, so they would be setting this for Mass General Law, Chapter 30B, as well as other factors that might trigger the way that this would be, the format that this would go in. The 30B has had some changes, and so are you calling this a request for proposals?
I am not. I'm saying that this is it. So I'm using my the 30B guidance that I work with in the other communities, that this would be below the $10,000 threshold. And so there's no requirement for it. It would just be asking for quotes from vendors.
So what's the rule for award on this?
Sorry.
Are you saying that whoever gives the lowest price
Oh,
would be
yes.
successful
We're
bidder?
bound by lowest quote.
Okay,
So we'd want to make sure that we have the elements in this list that we want before we put it out.
so the problem is that if
Sorry,
Yeah.
I've got background noise. Sorry.
do you have minimum requirements for what the consultant must have? Because we're inviting for firms to participate, but that could get forwarded to other firms. There could be other people, who want to submit. So the question that comes to my mind is, would we have a minimum set of requirements that we're asking for here?
No, I mean, well, beyond, I think that what we've said, sorry.
That may be something that the procurement officer would want to have a little more detail on, just to make sure whatever we're getting for responses would be the lowest responsible and responsive bid. So meaning the qualifications part of this.
Mm-hmm.
So we can take this and work with it through procurement, and I'm sure there'll be some back and forth.
Okay, so I'd really like to do whatever we can to minimize the back and forth and move this quickly. I feel like this is a important piece for moving us forward, and so whatever we can do, identify to assist in moving that forward, is kind of what I'm after right now. So I know, Rick, you had said, so I'm just gonna edit on the document here. I know, Rick, you had said referencing the blueprint for excellence. And I would say the 10 essential services. No one ever types well when they're like being viewed. 10 essential services. And then, if anything else is in mind, and then what did we say? Qualifications would be experience managing multiple Massachusetts health departments. For health and human services departments, experience providing assessment, because we don't want somebody this to be their first time out on this. Conducting operation. Anything else? I can make this look prettier, but Just want to capture our thoughts while we have this, not rely on memory. And as I said, do whatever we can to move this forward quickly.
Is there an anticipation that there'll be public participation in this? Some
So
sort of,
this is just an assessment of the operations of the health department. I don't anticipate that. I think that's it's a, I mean, for lack of a better term, it's like an audit. It's a review and sort of a look at the org chart, look at the staffing pattern, look at the responsibilities, and be able to benchmark it against existing things like the Blueprint for Excellence and the 10 essential services. I think public participation would be something that would be part of a actual community health assessment. This is not that. This is the predecessor to that. I think the board agreed that we wanted to get a handle on making sure what were the internal operation needs, what are the internal operation assets as exist, and what are the needs. Am I saying that? Am I reflecting that accurately?
The strengths and the needs, yeah.
Yep.
Okay.
That's right.
Okay, thanks. And as a reminder, this conversation started in August with when Eleanor Shonkoff was still with us as chair. And then I think we started that conversation. Then there was some subsequent conversation about potential need for a health director within the department. The board, was in sort of general agreement with that concept, but wanting to have an assessment done to see what existed. I know staff had their issues and concerns about additional positions and the like. And I think we landed on an assessment as a good step forward to give clear information.
Yeah, as I recall, there was some, we were having some conflicts around timelines and decided that rather than rush things through, and the fact that there hadn't been this type of assessment in some years, that this was due.
Right.
Rather than rush into the whole thing.
Right. And I will say that, because we don't know what the results of this would be. I think I believe that there's a need for additional administrative support. I appreciate Laura saying, wanting to take on work for us, but I feel like there's a lot of, there's definitely a current need for that. What other findings would be, I don't know. I have, been in communication with the town manager about, knowing that the warrant is closing, and what does the Board of Health need to have in place in order to be prepared for whatever results might be from an assessment. And he assured me that the board has what it needs and that he believes that this is an appropriate course of action. And I am content to take, I believe he understands what we've talked about, and that, I think so we're set. So to me, the next step is moving on this assessment piece, and then we start talking about the internal assessment, and then the natural follow-on, which we're not ready for, would be the larger community health assessment. Again, looking at what are the strengths and assets in the community, and where are we with the Blueprint for Excellence, where are we with the 10 essential services, and how do we position Reading for success based on what the community needs are.
Agreed.
Okay.
Agreed.
So,
Can I add one thing in that, in terms of what the final report, I noticed I think it was, I don't know if it was the Plymouth or Nantucket assessment, that they talked about an accreditation,
Yes,
that there's actually a health department accreditation
There is.
national process.
Yes.
It would be interesting to,
Mm.
as part of this report, to understand the gap between, our current status and what it would take to be accredited on a national level.
yes.
Because often those accreditations nationally are, widely recognized standards. And I get a sense from the Blueprint of Excellence report that the 351 cities and towns of Massachusetts often have, very under-resourced health departments. And so it would be interesting to see where we are, not only because otherwise one might say the consultant might look at Reading as compared to surrounding communities and towns. But if all the surrounding communities and towns are also under-resourced, that may not be helpful, or they may not be performing the way we want them to perform, or we would hope they would. But at a national level, that would be perhaps more useful. A higher
And
standard.
also in terms of implementing best practices.
Right.
Yep. Readings, okay, thank you, that's a wonderful suggestion. So including assessment of Readings, readiness for, Readings readiness for,
National accreditation.
yep, for national accreditation.
For health departments.
Yep. For health departments. What is needed? What would be needed to become accredited? There, I added that. I didn't do it in a different color, so I don't know if that's, but is that okay?
Yes, that's good.
Okay.
Mhm.
So maybe I'll change additional to benchmark. Blueprint for excellence, and essential services, qualifications for consultants, experience managing multiple Massachusetts or health and Massachusetts health or health and human services departments, experience conducting health operations, health department operations assessments. Okay. All right. Okay then. So I'll forward this. Thank you. Like I said, just wanting to minimize our if we can minimize our back and forth so that we can get on, because I know August feels like a long time ago, but I think we're very agreed on this. I think that it would be important to move forward. We know that there's revolving funds available. We know that based on the information that I have from others, this is something that can be brought in below the $10,000 threshold that would require going out to bid. And if we're wrong on that, then we need to know that and move quickly. So, okay. There. Anything else on this topic before we move on to minutes?
Carrie, are you saying you're going to send this around to the board again to review? I didn't catch that.
I know I was going to send it to you and Laura for the chief procurement officer review.
And then to have it be sent out, or did you want to look at it again, or?
Oh, absolutely. I would want to make sure that it would absolutely, if anyone's going to change anything that I've worked on or done, I would absolutely want to see it and, have a redlined version of what the changes were and why. So that,
Okay, so
And
we
my, and the board members too, just for ease of review. Yes.
so we'll get a red line version going. Now, the only other thing we need to do is identify a funding source.
So we had already agreed that we would use the revolving funds for that. I think that was actually your suggestion, because thank you.
I don't think the board took a vote, but I could be wrong about that.
I thought we did. I'm happy to take a vote again. Is anyone interested in making a motion?
I'm sorry, before you vote, didn't Bob say that the revolving fund is at 0 right now? And that's what my last sheet that came out said, that there was no money in the revolving fund. Do we know when those funds will be available again?
There is a technicality on the revolving fund. Not that there's a 0 balance, but that there is a vote, I believe, that the select board has to take tomorrow night.
Yep.
To certify those funds as being available.
Yep.
So
The funds exist. They're currently frozen because of
town meeting, something or other.
feature of something that came, and that there needs to be a vote. Yes, that's my memory as well, Jean, that needs to
Okay,
be.
good. I just wanted to make sure we weren't trying to purchase something and then having to wait.
Yep. So I would entertain a motion of whether the board would be willing to use, entertain sounds so fancy. Use authorized use of revolving funds up to $10,000 to support a health department internal assessment.
Happy to make that motion to use revolving funds for an internal assessment.
Second. Sorry.
Good job.
It's like tennis.
I
Roll call. Carrie, yes.
Oh, yes.
Motion passes. All right. So we've authorized use of funds. So we'll get this reviewed. We'll get feedback from procurement, indications of whether there are things we need to modify or make clearer, and hopefully move this forward. And that when there are modifications, that'll be shared with the full board so that people can see what changes would be and so forth. Okay,
Sounds good.
great.
Thank you for your work on that.
Yeah, thank you. It's very good.
Thank you. Big goal to get us moved. So,
Indeed.
okay. All right then. So hearing no more, let's move to minutes. I know Jean and Laura and our whomevers were working very hard to get minutes for us. And I know I had a message from Laura with a set of 6, I believe, minutes that had been reviewed by other board members. Starting with April 24th. I don't know if other members have had an opportunity to review, had any comments on those.
I think I've done them all.
Yep. Rick, were you able to review? Yeah.
Well, I reviewed the ones that my first board meeting was July 23rd, so I sort of don't are unable to review minutes earlier than that because I wasn't present.
Well, this is true, and I'm in the same boat, but
Right.
because the other members are no longer here, I just grammatically reviewed them.
Okay.
I can't review the content.
Right.
Yeah.
Yeah.
I mean, I do feel like we should just put them to bed,
Yes.
And it'll be great when we get to a point that every meeting, all we have to do is review the minutes from 2 weeks ago. Because we
Right?
can actually remember, not to mention we were actually there.
Yes.
So I'm
Yep.
fine with the minutes that
Okay.
did come. I mean, I did read through them, but I can't comment on the content.
Right. Yeah, no, understood. Understood one, if there were
Yeah.
questions that you had. So I did have a couple questions because the way they came to us, I just am not clear on process here because, for example, the April 24th ones, there's a lot of highlighting on them, and I don't know if that's highlighting that's gonna that indicates something that was resolved or what? Because I would approve them, but
So I highlighted a lot of stuff that was either unclear or grammatically incorrect.
okay. So, right, so, I don't know, am I sharing the screen with, do you see April 24th and you see, highlighted yellow controversy in the middle of the screen? No, I'm still on the other document.
That's what I did. It was using the word controversy instead of controversial.
Right.
That's the kind of thing I did. That's what I did.
Yep. So here it is. Right. So I just wanted to short into effect, right?
I see, yeah.
So this was the meeting that I wasn't at, so I was just doing
Right. Understood.
grammatical correction.
Understood. And I think I'm listed as having visited. Is this the one that I popped in for a little bit, but I was a civilian at that point.
I'm sorry, Carrie, what date is this?
April 24th.
24th, okay.
So, right. So there were some questions. So I mean, I guess I could, which will tell people, right. There were some gaps is what Paula's review has highlighted. And I don't know how to fix those. I don't know if at this point we approve the minutes as provided to, if this is something we can clean up. I don't know, Laura, have you been able to pull up April 24th?
I have the minutes up in front of me, yes.
Right, that's what I'm asking. So you can see the yellow highlighted pieces.
Correct.
So I have reviewed and I have the same questions, and my question to you would be, how do we fix these yellow highlights?
I don't have access to the Zoom recording, so I can't check them, so that would be up to the board.
Who has access to it?
Jean.
There isn't a recording for April 24th. I don't think we started doing the Zoom. I'd have to check on when we started with Zoom, but I want to say it was the end of May, maybe. There's no recording.
We could in these yellow highlighted areas, could we just insert parenthetically some disclaimer or some, that it wasn't clear what was said, or
Right.
And just kind of leave it at that, for the future, and so anybody who wants to go back could at least see that we're not sure about this.
Right. That would be my preference to get us, as you say, Rick, to move us forward.
Could we ask Eleanor, the previous chair, to come back and comment on it, or I don't know. I don't know how that works.
We're missing our what
Kevin.
I call Kevin our parliamentarian, Jean, can you offer us any guidance on this?
I mean, the way these minutes are prepared is it's a level of detail that I believe is unnecessary.
Oh, I agree.
Yeah.
Either you can do the tweaks like you're talking about, or just summarize and have a very simple set of minutes and not worry about this one said this and that one said that. I mean, we could give this to Jackie and ask her to do a summary set of minutes based on what's here.
That sounds good to me.
Okay, I'm torn frankly between the, I know that there have been requests for the minutes and there have been concerns raised that the minutes aren't available. I'm torn between wanting to provide a record and pushing it back to be revised again. And it's not clear to me what the best course of action is.
So I'm not clear either,
Right.
but, and which is why I didn't do the actual corrections and why I put them in parentheses and highlight, because I didn't think I could alter a document, especially one where I was not in attendance.
Right.
I mean, I understand what Jean is saying, although it then layers another layer of interpretation on almost verbatim quotes that we don't even, there's some places where there's confusion.
Mhm.
It feels to me better just to either parenthetically or asterisk, unclear comment at this point, and so that the reader beware and just leave it as it is, face value.
So approved as submitted.
Approved as, yes.
With corrections?
Well, I don't think we know if anybody,
I was thinking that where the statements are unclear or questionable that have been highlighted in yellow, that we just have a footnote or a parentheses and just say, we ought to be able to word a sentence that says that this part of the dialogue was unclear and not accurate and not accurately recorded or something along those lines, so that the reader could understand that we know it doesn't quite make sense or it's unclear, but this is what we have. Call a spade and
I just want to make a correction to something I said earlier about the recordings. We had two separate accounts. So the account we're using now is the one that had, I think, from the end of May or the beginning of June. I just checked the other account and I do have a recording.
oh,
So if you want me to go back to the recording and work on this, I'd be happy to do it.
that would be cleaner.
yes, agree. Thank you, Jean.
Yep. Sorry for the confusion.
No, that's all right.
It seems like a long time ago.
I don't have any doubt. I know that you and Laura have been here for what are we up above the 60s in meetings now? We must be. So, okay.
Okay, I'll do
So April 24th is going to go back to Jean for clarification with recording.
Yep.
Next one, all right, stop share. Next one is June 4th. And I am looking at my notes. Yeah. Sorry, give me a second to share.
Did you say June 4th?
That's what I have.
Okay, 6/4. Yeah. I'm just trying to find it.
Yep.
Okay.
6/4. So 6/4, it looks like it's there's different colors of text. I don't know, is that you, Paula, the blue? Or is that somebody's edits?
No.
Okay.
Nope. Somebody else did that.
Okay. So there's if Jane plans to, can post it on the homepage. Is it somewhere else on the website? I can't remember. Everyone okay with it? This section was the piece that I wasn't sure if that was you, Paula. Like I said, I wasn't sure if that was you.
No,
I didn't know who was what.
Yeah.
so this was one, Eleanor.
Mhm.
So I thought this was one Eleanor sort of asked somebody to go back and look at the recording to clarify this. If that was my recollection.
So maybe this goes on Jean's list to just look at these particular points
Okay.
and just edit something cleanly.
Yep. So 424 and 64 for edits and clean. Okay. Stop sharing. And then the next one.
So those are going back to Jean?
Correct. Well, that's what I,
And just for time purposes, it's 8:55, so, or 8:56, so you know.
do we have a hard stop at 9?
I have a hard 6-year-old that has to go to bed, just
That's,
so you know,
that's
sorry.
that's fine. I mean, that's fine. I wasn't aware.
And the meeting was posted till 9.
Okay. So the next one is June 15th. I didn't have any comments on that.
I have 2 sets. I have the regular draft, and then someone did additions.
So the draft that I have, that I am sharing, second.
I actually went back to the tape on June 15th and provided what the tape said and clarified. So what you just asked me to do on these other 2, I already did for June 15th.
Okay, so then am I looking at because the version that I have is this one I'm screen sharing now, and there was a page on page 3, there is this
Yep, that's the one.
notations. I'm
Yep.
sorry?
Yeah, you have 2 of them. There was the original ones, and then there was another set that Jean corrected.
That's the one that I worked on. Notes on the bottom.
Okay. So, okay.
Should we move to accept these as
Sure.
corrected?
Sure. That would be great.
So I move that we accept these minutes as corrected.
The June 15th, 2020 minutes.
Yes.
Second. Roll call, Carrie, yes.
Oh, yes.
So moved. Excellent. We've got a set of minutes approved. So 6/15/2020 approved. Let's see if we can. I had a lot of questions about the next one, which was July 6th. There were names I wasn't sure about. There's a reference to somebody named Glenn, and I don't see Glenn anywhere on the.
This is mine, and that was my error. It's Greg. I put, for some reason, I wrote Glenn.
Okay.
I think I gave some edits on this early on. Does that sound right, Laura?
There's some. Yeah.
Okay.
And
Hold on,
this
I'm
is
just
my
still
first
finalizing now.
of board minutes
Yeah.
ever
I think,
Thank you.
with no instructions. So I apologize for the.
if I'm remembering correctly, and it's hard to remember everything, but I remember Paula And then I remember taking some time and reviewing them, and I think I caught the thing about Glenn and said, I think you mean Greg, but I don't see that
Yes.
on the version that's been distributed.
Right. So it seems like we've got a version control issue, because I know in here I saw too, oops, am I not sharing it anymore? There's lacrosse is misspelled. So that's why I wasn't clear if I had the best version. So 7:15. So why don't I give back my comments on the 7:15 beautiful minutes that Paula gave her first effort at. And I will send those back to Laura and Jean, and I'll check and make sure I don't have a version control thing happening, and maybe I was reading the wrong set. And there's a cleaner set. And that gets us to 7:15. And I am conscious of the time and our need to have a thing. So 7:16. So I was not able to get to the August minutes that were after that. I will commit to getting to those and sending either my assent or comments to them. So I think, and that's what I have. That was sent to me on 9/17 at 3. So that's what I've been working from.
Minutes, you're talking about 7:16?
Yes, July 16th. I had. So there was lacrosse. It sounds like I've got the wrong version, because lacrosse was spelled as with two words. So it's LA space CROSS. And then there was the Glenn thing, and then I had and it looked like there was a statement that it seemed like maybe you were making, Jean. Oh,
So these were the ones that I had worked on. So 7:16 is definitely on there.
right. So I don't know so Laura sent sets of minutes on September 17th that include the July 16th version. I don't know, we're not combining. This is another process question, I guess. Do we have multiple sets, and sort of how do we reconcile that?
We do have multiple sets. Can I? I'm sorry.
Yes,
I don't mean
please.
to interrupt.
No, this is
We do
yes.
have multiple sets. Sometimes the changes aren't like a simple word. Some people end up like rewriting entire sections. So it's hard to determine like it's just like completely different. So that's why I send you both sets.
Okay. So it's okay. Okay. So there are multiple sets of some, and I'll look and comment on both, and then you guys will have to reconcile. I guess I'm not sure how to blend those streams, or maybe I'm just dense. I'm not sure how to accomplish that. If we've got two sets, how they get turned into one.
So what's the issue with July 16th? I'm not following.
So I reviewed July 16th that was sent to us by Laura, CCU. I made the mistake. I thought that was a combined set. I didn't realize that there was the set that you had sent on the 8th, and then there's a set that Laura sent on the 17th, and I guess those they're not the same. So I need to review both of them
No, but
and
the
then
one,
give comments?
716 should be the same. Do you have more than one set of 716, Laura? I don't.
Yes, I have the original set and then I have the set you did.
Well, the set I did is just like what the board just voted on for 615.
Whatever the board wants. And I send I send everybody's corrections so that everybody can see them. And
So the original set was what had the questions. I went back to the tape and I created the set that has my initials on it for 715. So it's the same as what we did for 615. I'm sorry, 716, I should say. So the original set had issues flagged on them. I went through the recording and addressed the questions that were flagged, and that's the version that Laura sent out.
can I ask a question that might make it easier? And I don't know if this is at all how they do it. Is it possible to post all the drafts and then one final? That way the public can see the public can see where the changes are, or is that not?
No, the
I don't-
town won't post a draft.
Well, but Laura, you're talking about posting multiple sets of the same. I mean, I think we need to have one version that has
Track
all
changes.
of the information and track changes and see so that we can understand, because line and line comparing isn't efficient. And what I reviewed from what the email, I understood that the email that I had from Laura on the 17th was a more, I'm assumed, shame on me, that there was a more updated version than what I had seen come through from Eugene on September 8th. I hadn't had the opportunity to review the September 8th message. So I reviewed what was in the email on September 17th. And that's the one that I'm saying. I see the word lacrosse spelled LA space capital CROS. And there's the references to Glenn, and I had another question. So, but it sounds like that's not what you would have sent on the 8th. And that was where it sounds like this is where there's two sets, right? You would have corrected lacrosse.
Yeah, you're talking about a different.
Actually, technically, there's three sets because the original set was the one you wrote, Carrie. Then someone had changes that I highlighted in yellow, and then there's Jean's set. Look, stop it. No. My somebody's corrections got highlighted in yellow. I don't know who called them in, I forget. And then there was the Jean set. So I merged the original comments in. So those yellow markings are already someone's corrections.
So I don't know how we can get to a place where board members are given one set of minutes that has all of the comments in it, but trying to review multiple sets of the same is it to me is fraught with peril and a lot of work. I again, process question. I don't know how this gets reconciled. And I look to staff to help us or the board, staff or board, if anybody has an idea, or again, if I'm being dense and there's an easy solution, please enlighten me.
Well, I don't think we're going to have these problems going forward because now we have someone who's working off of the recording and presenting the minutes. So I think it's really the back issues that are challenging.
Okay, and that's great, but I want to figure out how we review and approve a set of minutes for all of the dates that we've got outstanding that we're responsible for, and I don't know how to get there. Can somebody combine the 2 or 3 word documents? Do a combine of the 2 or 3 word documents? If there are 2 or Laura's saying there are 3 versions, can somebody do a combine of those and then send those to the board to review?
I wouldn't even be bothered with the earlier versions of the minutes that I spent hours reviewing tapes and correcting minutes. I think I think that those minutes that have had that level of scrutiny and review, you don't need the older versions. I think it's just confusing.
Right, but what's further confusing is that I took that what I got from Laura was the most updated version, and now I'm learning in our discussion that it is not. Because you're saying that you did work on minutes that came on, that you sent on the 8th, you showed us.
Yep.
I again made an assumption that documents that were sent to me on the 17th were more updated versions of what had passed through earlier. It's not, that was an assumption. So that's what I've been reviewing. And now I don't know how to decide what's most current.
What, is there a recording of these minutes?
That's what I worked from, the recording. I went
Oh,
back,
you
took the notes and reviewed the entire 2-3 hour meeting. And
Well, that should,
Maybe we should
So
just go
let's-
with Jean's copy
so
and
let's-
call it a day.
So I need to look back at Jean, and not the things that Paula sent. No, sorry, I'm looking at Paula's face. Not look at what Laura sent, look at what Jean sent. And as you say, right, I mean, I think everybody has the goal. I want us to be able to move forward on these, so, okay. All right.
Can I just say one thing? I did send you all versions of 716. So I sent you the original with that Carrie wrote, with the addition, with the corrections that someone made, and then I also sent you Jean's corrections. And you received all those on 9/14 at 2:09.
But then I got another set on 9/17 too. So this is where I'm,
Because I was asked to send them all again, but that's exactly the same. There's two set. There's the set that you wrote, Carrie, that
Yeah.
someone corrected, and then I added the corrections in yellow, and then there's Jean's corrections.
okay.
You did receive all three. One person just made small changes, so I added them in. So where it says Christine and Christine Harris's name is spelled incorrectly, I changed it on your minutes, Carrie. But then Jean went and did additional work. So I sent you both your original, the yellow corrections that someone made, and Jean's. And I can resend them, but you do have all three.
No, please don't. I am awash in minutes. I am awash.
would the tracking spreadsheet be helpful? I know, Laura, you updated that, right? The minutes tracking spreadsheet?
Yeah, but how does that help with all the changes within the minutes? They have the tracking sheet. I sent the tracking spreadsheet out to everyone,
Right. So,
but that doesn't say like, okay,
Does it say which version is the most current, is the
no,
most
it says it in your
one?
email. So like, if you look at the email on 9/14 at 2:09, it says the minutes that you wrote, Carrie, with someone else's changes in yellow, and attached on that email is Jean's minutes, which say -JD for Jean Delio.
Okay. All right, I'm gonna go back. It sounds like I need to go back and look at the dates of the minutes that Jean sent. If there are multiple sets, Jean's
Do
set.
you want to just throw out everything and I'll send everybody one blast right now with all the minutes? There's 39 copies.
No, I
No,
mean, I'm sorry, but no.
Okay.
You
All
can't,
right,
you can't see us, Laura, but we're like, oh my gosh, we're laughing, but we're also like, oh my gosh, so many minutes. Thank you. I know you're trying to think about ways to move us forward, but no.
no more minutes.
well, I know one of the things that has worked in the past when we had a lot of minutes was having one meeting to just do minutes.
I was thinking about that. That's a good suggestion. And like an extra board meeting, you think?
Yeah, just one meeting dedicated to just minutes.
Okay.
I mean, the
just
thought
need to know-
nauseates me, but
It does, right, but I still need to know which one is the one, because I can't read 3 sets of the same meeting and reconcile and make changes. That's what so I'm happy to have a meeting that's just minutes. I just want to make sure that we're all reviewing the same document and just one.
so it sounds like the 17th is the most recent and updated.
15th, 16th, 15th.
You talking about September?
Or- yeah. Actually, I have one on the 16th and I have, oh, yeah, they're days, all 14, 15, 16, 17. Yep, all of them. So the 17th says Board of Health draft edits, and that has 8 in them.
Right, right. And that was the one I was working from, because like I said, I made an assumption that that was the most current version. I knew people were working hard and trying to get us caught up, get us documents to review. I made an assumption. It's clearly the wrong assumption. Paula, were you reviewing the ones that Jean sent?
Yep.
Okay, so I'm the rate limiting factor. So I'm gonna go back and try and untangle myself, and I will review minutes that Jean sent and provide my comments. Does the board wish to schedule a meeting to review only minutes?
I would be happy to make that motion.
I mean, we can do it. It should be a relatively short meeting if we
Yep.
have the final version of the minutes we have to review.
Yep.
It would just be nice to get this behind us. So
I agree,
we're willing to do that.
agree.
Thorn in our sides.
Agree. Okay. Does anybody want to propose a date? I am not going to be in a position to, I'm sorry, I'm not going to be in a position to review minutes for at least a week,
Okay.
starting on September 25th. And I hope that I will be after that, but I don't know. But I'm not going to be in a position for at least a week. So next week for me would be out.
Okay. So if you want to try in 2 weeks? On
Well, our
a
next
third-
meeting is October 1st,
Correct.
our regularly scheduled meeting.
Oh, and
Correct.
that's 2 weeks? No, that's 1 week. So the week after that.
So
Oh.
we're a little out of sequence because we were supposed to meet on the 17th and we didn't. So our
Right.
next scheduled meeting, which we'll keep to, is October 1st.
So let's say October 8th.
That work for
Or
you,
we
Rick?
could,
Or we could,
October 8th. I mean, I can do that. The other option would be meet October 1st and meet a little earlier, like, 6:30. Could we do this in a half hour? You
so
think?
unfortunately, I'm not sure. I'm not sure I'm going to be in a position because that's next week.
Is that next week?
It
Oh,
is. I know.
scary.
It's
Yeah, wow.
terrifying.
Okay. Okay. So the 8th, October 8th?
Yeah,
Does that
fine by
work?
me.
Is there, okay,
Wait a minute, we're still meeting on October 1st, right?
yes.
A
Yes.
regular meeting, right. That will not include minutes on the agenda, right? Because
Right.
we're all going to do them on October 8th.
Okay. Do we need to vote on that?
And then just to wrap up October, then the the Board of Health will meet again on the 15th.
Yes,
Right.
Yeah,
that's a regularly scheduled meeting on the 15th, correct? Oh, so interesting. So that would make command, that's the holiday week, so command would be tentatively scheduled for the 12th, but whatever, we'll figure that out. Okay. All right. So, I will make agendas for the 1st and the 8th. The 8th is minutes only. The 1st will be regular shindig, but no minutes. And and I'm gonna go back and review a bunch, and I apologize for my own, whatever.
we all got a lot going on.
Me too.
Uh-huh.
Gonna get through this, and I think that's it. Any motion to adjourn?
Please, may we adjourn?
Second.
I love it, really.
Roll call. Carrie, yes.
Paula, yes. Good night, everybody.
Good night, everyone.
Good
Thank
night.
you all.
Good luck, Carrie.
Thank you, Rick.
Good